write things that are very incremental, very safe, because we worry about maybe we won't get funded if we propose something too risky or too ambitious. I was one of the reviewers for the Audacious Goals program. Reading through them, it was one of the most exciting things to see the creativity and imagination of this community. People were so inspirational. Here at the meeting, we're now discussing and developing some of the ideas that were the top selected Audacious Goals.
The audacious goal that we came out with in our group was the thought of finding ways to better understand how a disease progresses. So, for example, most patients come into your office today when they can't see anymore. So by the time we begin to treat these patients with the currently available drugs, we have a meaningful intervention in some percentage of patients, but most of them don't benefit from this. If we could better characterize aging-related diseases and how they first manifest themselves in the eye, and we could sort of pick those up early, we'd have the opportunity to intervene therapeutically at a much earlier phase when they're much more likely to respond to the treatment.
I get emails and phone calls almost every day from someone who has a different eye disease, wanting to know when a therapy will be there for them. Doctors for so long have looked at their patients and said, "There's just nothing we can do." And that's slowly becoming a thing of the past. Doctors are able to identify what the problems are, take action, and that is invigorating to the science community. It's certainly hopeful to the millions of people that are blind or vulnerable.
The repercussions will play out, and it's going to have a long-term effect and change the way people go about doing their research.
I think that we are going to see some real marvels ahead of us in how people can benefit from the ideas that come out of this meeting.
What could we, putting all the brain power that exists in this eye disease research community, imagine doing that would be truly groundbreaking? It's just the right time to ask that question.
So I guess I'm the person now standing between you and your cocktail. So I'm going to end here, and hopefully there are some questions. And if not, Professor Natarajan will give you my email address and as well as my phone number. And I welcome any suggestions, any comments, any email from you. And I also personally, I want to extend an invitation to you to visit the National Institutes of Health, the National Eye Institute here in Bethesda, Maryland. It'll be a pleasure and honor to actually meet some of you here next time when you visit the United States. So please make sure that you do contact me. And at this point, I'm truly honored and humbled to accept the first endowment award that has been established in the memory and also through the hard work and dedication of Professor Natarajan, and in the memory of his mother and his for the hard work to honor his hard work of his father. And I just want to tell the team that this did make it in one piece to my office here in the United States. So thank you very much for the for the award. And I'm going to stop here at this point and see if there are any questions. So thank you very, very much.
Thank you, John. And I think the entire audience appreciated. Can I request the audience to give a standing ovation to John? You can see them all standing.
Yes, thank you. Thank you very much.
Thank you. So I'm sure we have some questions, and it's a great honor that you gave the first public endowment lecture.
Thank you very much.
And my dad is here, and he's appreciating you. And somebody complimented him that he's immaculately dressed and come for today's occasion. Only thing, you're not here. So can I ask Nandita to say a few words? You can probably come here. And Nandita is here, John, and she's here right from the early in the evening. And I think the people are here from afternoon attending the conference, as well as, you can look here, so that, come here.
Oh. Thank you, John. On behalf of NIH, NEI, we appreciated your...
Hey, John, this is Mike.
I can hear Nandita is speaking.
Yes. We appreciated your endowment lecture, and I wanted to thank you, the Aditya Jyot Foundation, for inviting me and for allowing Dr. John Prakash to give this lecture today. And we look forward to continued interaction with you. If you have any questions about the NEI portfolio or ways to collaborate with NIH in general, please do not hesitate to get in touch with me after this. Thank you.
And I have here my friend and Dean of our Aditya Institute of Optometry, Dr. D.P.N. Prasad, who is an educationist. He is a PhD in education, but he always said I should do some research, and I think I want him to say a few words to John.
John, we are excited. We are very happy, and we heard a lot of new concepts from you. Some of the concepts in which Dr. Natarajan is working at, that is the artificial retina. And you were saying something about powering that artificial retina by solar power. That was exciting. And we all feel very happy that we are living at a time when Natarajan lives in India. Such an intelligent person. He calls himself weird. And he says that all leaders are weird, all experts are weird, all scientists are weird, and he is weird. And we appreciate all his knowledge. The work that he is doing in Dharavi slums. I used to have very close interaction with those people in Dharavi because I am the chair of the Leprosy Mission Trust India. I run around 15 hospitals in India. So they used to call him demigod. Natarajan is demigod for those people whose eyes are being looked after by this great man. So thank you very much. Today we were listening to another genius. God bless you. Thank you.
And John, thank you, John, and thank you, Dr. Prasad, but I didn't want him to appreciate me, but I wanted him to tell that he is always behind me to do research. And the other great man here is Dr. Kumar, who is my right hand and left hand for research. And before Kumar, Mr. Ravichandran, our CEO, spoke, and before I invite Kumar, can I ask the youngest optometry student, I don't know, did you see a slide on optometry in India? Any of the youngsters? Who is the first year optometry student? Can one volunteer come here? There are a lot of students here, and Rotarians are here. Rotary President, where is he? Dr. Sharma, you have any questions? Come on. So we have a young student here, and we have another, John, I mentioned about your discussion in private with Dr. Badrinath. Why not all major eye institutes in India come together? And all the institutes are here, and they have promised they will work together. And introduce yourself.
My name is Syed Firoz. I'm the first year student of optometry. Good evening, sir. My name is Syed Firoz. I'm the first year student of optometry. And what should I? What did you learn? Yeah, I'm totally nervous that. So we need lots of optometrists for the India and all the worlds also, sir. Okay.
Kumar.
Thank you, and I wish you good luck, too.
Dr. Sharma is an anesthetist. He has seen ophthalmic surgery more than anybody here, I think, in this hall. And maybe I don't know what he wants to say. Or you want to question him? No, somebody should question him. Otherwise, he's going scot-free.
I'm Dr. M.M. Sharma, and I'm really thankful to you and Nati for bringing you and giving us this talk. Thanks a lot for putting a lot of Prakash on this ophthalmological Gyan. Thanks, Gyan. Thank you very much.
Thank you. Thank you very much, sir. Thank you.
Thanks, John, for giving a wonderful talk today. We all enjoyed it. And at this point, I have to make one mention, is that this entire connection of Aditya Jyot with the National Eye Institute was possible because of Dr. James Fielding Hedgeman-Sick here. Who gave the connection and made that possible, so therefore I'd like to thank him. And of course, Dr. Natarajan has a lot of interest in doing basic science research, and I'm glad I'm able to help him out. And we have started off with this epidemiology project at the Dharavi unit of his service. So we hope that we can take it forwards. We have great people with us, young scientists and ophthalmologists like Sunita Alok has joined us recently, and of course Dr. Radhika, who's taking care of the whole project. So hopefully we as a team will slowly start to emerge out, and we request all the distinguished scientists who came over from different parts of the world to extend their kind support for research at Aditya Jyot. Thank you.
Wonderful.
Hi, sir. It's me, Radhika, here. Considering that we have a mixed audience, I just wanted to ask you, the unique position that you are in, what do you think needs to be done in India particularly to increase or rather foster a sense of, the need for research? Because I think most of the people here are working in clinical practice, and there are a growing breed of researchers, but most of the doctors are only involved in clinical practice, and in general in the community also there's not much recognition given to research per se. So what do you think needs to be done to enhance the basic awareness in society here?
Radhika ji, thank you. First of all, thank you very much for inviting me to Video Link. And it's really an honor and pleasure to be working with you, and thank you for all your help in New Delhi last week. So unfortunately, because of the echo, I'm not able to understand the questions. So I don't know at this point if there are any questions, if there's anything that I need to respond. But so I'm just going to make a comment here that since I did not hear any of the question, it's not very clear to me. But I'm going to tell you one thing, that it's very important that we all recognize that India has a very strong potential to really be part of the future, and that too both in clinical sciences as well as in the basic sciences. And our interest in working with India is obviously that we want to tap on the collaborative activities and the programs that we can do together in terms of basic sciences as well as the clinical sciences. You have a unique patient population, you have the genetic resources, you have well-trained clinicians, you have very well-trained basic researchers. So combining all, there is a tremendous opportunity that's available in India at various centers. You have in Delhi, in Mumbai, in Chennai, and then in Bangalore, Hyderabad, Madurai. So obviously, all these are, it's amazing resource that we could be part of the global development of science. And I think it really makes sense for all of us to be combining our resources, combining our talent, and in a tough economic time, it really makes all the sense to really pool our resources to work together for common goals, for discovering, and doing good science. So since I didn't hear your questions, I just thought I'll just make a general comment. And if there are any specific questions, please do email them to me, and I would be happy to respond to each one of you, whosoever they're coming from. All right? So thank you very much.
Sivan? No, you can talk here, and I'll repeat it. Gyan, can you hear us?
Yes. Yes, I can. All right.
Rotarian.